All right, it's time for our Kegel exercises, Twila.
Yes, it is.
And so why do we do our Kegels? Well, it's important for our pelvic health for both men and women. It helps, these exercises help support our pelvic organs in women, the bladder, the vagina, the rectum, the urethra. And for some people, it can actually improve sexual functioning. Some people say it makes orgasms more intense and more frequent.
Well, I think that's a good enough reason to do them right
Nobody's going to
there.
argue with that, I don't think. So let's go ahead and do it.
Okay. 3
times a day.
6
Days a week.
9
Seconds per Kegel.
and 12.
Kegels in a row to make a rep. It's so easy. Just do 12 of these 3 times a day. When you're doing them, hold it for 9 seconds. You will be the envy of your neighborhood. You will have a pelvic floor like a chain link fence, so you will be able to pull a trailer.
If you so choose. And don't forget, you can always go to the GynoCast Facebook page and get an infographic, which kind of details out the customizable plan. You can print it out, put it on your fridge. You can put it up in your office. We can share it with your friends. And it's a great resource to have. So
Indeed.
Make sure that you go and do your exercises today.
Yes.
Stay tuned.
Hello, everyone, and welcome back. You are listening to the GynoCast. My name is Dr. Eric Heegaard, board-certified obstetrician-gynecologist. I'm here with Twila Dang, my boss, my buddy, my co-host, my co-pilot.
Hi.
Nice to see you again.
Nice to see you, too. I love the enthusiasm. It's like you're happy to see me.
Well, I am. It's so fun to be able to do this with you. I can't say that enough. I've for those of you who are new to listening to the GynoCast, Twila and I have been talking about these subjects for a while, and so it's important and we enjoy it. Today we are talking a continued conversation about sexuality. We're going to talk about sexuality and cancer with Dr. June LaValleur from Minnesota Personalized Medicine. She's a consultant in sexual health, complex menopause, and this is the best, Dr. LaValleur, soulful aging. I just love that, again, and so this is one of 2 episodes or podcasts that we've recorded with Dr. LaValleur. The other one is about aging and sexuality, and so please go to our website and listen to that too, because it's fabulous.
Yep.
So, Dr. LaValleur, welcome back. You came back for more.
It's so good to be here.
Thank you. And Dr. LaValleur is a retired professor of obstetrics and gynecology. Well-known, renowned, actually, for her work in menopausal medicine, which, has been an area of women's health that was kind of a forgotten part and yet very important. And now Dr. LaValleur is an expert, specialist in sexual health. And so please listen to our other podcast. And today we're talking about another important topic, which is sexuality and cancer, because it can be very disruptive.
It can.
To say the least. Let's just jump in there.
Sure.
Take it, June, and
Okay.
run with it.
All right. So there are many phases to being diagnosed with cancer. And we could just focus just for a moment, if we may, on breast cancer.
Yeah.
So the woman feels the lump, and there's immediate terror and panic. And then there's going and getting the diagnosis, and then there's treatment and recovery. And what is so important is that we know that up to 80% of women who have been treated for breast cancer have a sexual function issue or a sexual dysfunction. And for many of them, it is lifelong. So it is really incumbent on the people who are providing care for these patients to prepare women for what may occur. Not necessarily does, but a high probability. For instance, if somebody is going to have radiation therapy and they have a mastectomy, that changes body image. It changes sexual response, because for many women, the breast is the most sexual organ. The nipple has sensations that are related to sex, but there are 2 purposes for the breast. It also has the purpose of bonding with your newborn child and breastfeeding. But it's a very significant organ. And we could also later talk about men and prostate cancer. But it's important when oncologists, radiation oncologists, etc., describe what is going to be the therapy and let them know that they understand that sexual function is an important part of life. It's an important part of quality of life. And just be aware that these things may come up. You can't really go into a full and total discussion at the first visit where you're getting the diagnosis, because we know that when we first tell people that they've got cancer, that,
it's
a
all blur
death
at that
sentence.
point.
But the reality is 80% of people across the spectrums of different cancers are surviving.
Right.
And so we need to think about surviving and quality of life. And every person who has cancer experiences it differently.
Mm-hmm.
And that's why individual treatment is so important.
Well, and I'd like to say that it may seem obvious, but some people might say, well, why are we focusing on sexuality when there's this perhaps life-threatening illness going on? And one of the things that we talked about in our other podcast about sexuality and aging is just the importance of sexuality, being a sexual being, in terms of just being healthy and quality of life. It is an important part of being a healthy, whole human being. And what I'm getting from you is that can be, and oftentimes is, impacted. Do you get a sense that it's even addressed many times before the treatment happens? I guess I'm guessing that it kind of falls down to one of the lower level.
It does fall down, and that is probably a very natural progression. Because the first thing is we think about our survival, and we think about what are we going to have to go through in the next week, month, 6 months, chemo, radiation. And so those things are going to be at the forefront. But we always need to keep very close the sexual function issues, because it's a huge quality of life issue. And as we mentioned previously, we have really good data that show that people who have a healthy, satisfying sexual life live longer.
Well, do you think that even part of this, the reason why we don't have this discussion is because and even referring back to the other podcast that we recorded with you, we're so uncomfortable talking about sex under healthy, normal conditions that I'll be honest. We've had cancer in our family. I've had many close friends that have had cancer, and we've talked about every aspect of the cancer, the diagnosis, the treatment, how we can be supportive of the treatment. We talked about really specific physical things like losing their hair, losing the weight. We've had friends with breast cancer. We've talked about mastectomy. I've never, on any level, with any of the people that I'm close to that have had dealt with and had cancer, talked about how they deal in sexual function afterwards. Like they never, like not even for surface stuff, like the kind of stuff we talked about, like advice on products and things that might be helpful or things like that. I remember doing research and just tripping over research that said there were products available specifically for cancer patients in terms of the ability to, provide extra lubrication, things like that. But it is, and I'm not that I'm super well versed, but I feel like this has to be an extension of the thing that we're already afraid to talk about, and it's only made worse by the fact that it's this awful diagnosis that comes along with it.
Yeah, you're absolutely right. And again, as I mentioned, we first have to deal with the issues of how am I going to get through the next 3 months?
Yeah.
For women who have breast cancer, for instance, they may need to have a mastectomy. Fortunately, today, that is occurring less often.
And that's removal of the breast. Most people know that.
Yes. And in days gone by, there was this awful thing called a Halsted procedure in which, all of the skin almost of the chest and armpit and everything was removed. And it really left fairly significant scars. That is hardly ever, if ever, done anymore. I'm not sure if it is. But most oncologic surgeons today do the breast conserving measures because it shows that there's no difference in survival.
And preserves aesthetic
Yes.
appearance as much as possible.
Yes.
Mm-hmm.
And there's no question that skin that has been scarred either by radiation or surgery is less sensitive. And nipple sparing, which is a type of the surgery, is being done a little bit more. But even if the nipple is spared, there's much less sensation because of disruption of nerves in the actual procedure itself.
Do you think, I want to go back to what I asked you before. It sounds like, and this makes complete sense, that the initial shock and intention is to survive and move. But do you think it would be helpful for women to have that addressed prior to the treatment, or do you think it would be overwhelming just to have that? The idea of talking about sexuality and changes following the treatment, do you think it would be overwhelming to them, or do you think it would be helpful to at least have the discussion so it's on the radar?
So, as I mentioned before, we're all individuals and we all respond differently. For some people, it may be overwhelming. For others who are told nothing about the possible side effects, it's devastating to experience them and not know that they're coming. Mm-hmm. And so initially, it doesn't necessarily have to be the surgeon, him or herself. It can be one of the nurses or one of the psychologists in the practice who will see these patients and give them at least some printed information along with saying, this might arise. If it does, please contact us. It is so common. And again, that's an important thing to let people know they're not alone. Mm-hmm. It is a very common thing. So to answer your question, there are some people that will be overwhelmed, but there are just as many or more who will be devastated not to know in advance.
Yeah. And I think you mentioned one of the other things I heard in what you were saying is that the idea of talking to people and the isolation that can come with certain diagnoses where you feel like you're alone. Mm-hmm. And that takes whatever you're experiencing and makes it that much harder. And speaking of that, I would imagine there are probably many support groups or resources for women who can reach out to other people that have gone through this. And
the one that comes to mind for me, and the one that I have been most connected with, is MOCA. I don't know if you are. That is the Minnesota Ovarian Cancer Alliance, and I've spoken to them several times over the years. And for some women, being in a group is very helpful. For other women, sexuality is a very, very personal thing, and they don't always like sharing it with other people. Again, you have to do an individual therapy or individual counseling.
So, in particular with breast cancer, I'm imagining that, as you've addressed, there's a lot going on. And let's jump a little bit to the post-treatment phase where the woman may experience significant anatomic or cosmetic differences in her breast locally, change in sensation, but also there may be hormonal differences that she may be confronting as well.
Yes, yeah. So most women who get breast cancer, and we shouldn't ignore the 1% to 2% breast cancers that men get. Mm-hmm. But I haven't dealt with that, so I'm not claiming to be an expert in that area. So I'll deal with what I know, and that's women. So if with breast cancer they have radiation, it does change the skin. It kills nerves. The skin can become quite reddened, and actually during treatment quite painful. That resolves almost always over time. Yeah. Lymphedema can occur, and again, this lymphedema is when the lymph nodes are removed from the armpit, the axilla. It disrupts the flow of lymph fluid from the arm out of the arm, and so it can be very, very swollen, which is very uncomfortable.
So there's a lot going on.
It changes body image. Mm-hmm. And, what is it, 98 or 99% of women are not happy with their body image.
Exactly.
Anyway.
You know, as a
Yeah,
baseline.
as a whole.
And so in the presence of a mastectomy, that changes the body image pretty significantly. And I think we also need to pay attention to other cancers, for instance, in women, cancer of the vulva, while it does not occur as often, it can be extremely disfiguring.
Yes.
And almost all people who have any kind of a major operation also have radiation therapy. And radiation therapy does the same thing to the vagina that lack of estrogen does, and that is the skin gets thinner and the introitus, the opening of the vagina, gets narrower, and really you need to be using dilators almost right away from the first surgery.
So they may have dryness as well as narrowing.
Absolutely. Back to breast cancer. I personally was diagnosed with breast cancer last year, and I can tell you that people know what I do, and nobody asks me about it. Nobody asks me about sexual function.
Mm-hmm.
So it's very common that physicians are uncomfortable talking about sex. But I was very fortunate. No radiation, no chemo, but I am on a drug called tamoxifen, which is an anti-estrogen drug, which does the same thing to the vagina that menopause does. Well, as I'm 76 years old, I already have those changes. Now, on top of that, it's tamoxifen-induced changes. So once again, the vagina is an organ that if you don't use it, you lose it. And so we talked in the earlier show about moisturizers and lubricants and dilators. And so those are very helpful tools for anybody who is on tamoxifen or any anti-estrogen therapy.
Yeah.
In terms of those types of tools, and I'm sure we'll probably get into a little bit more of this later, but are there very specific items that are more helpful for someone that is post-cancer treatment? As I think when we talk about things like lubricants and things like that, it comes down to, do you have, if you're looking, there's certain products we say use if you're trying to keep from getting pregnant, like certain things interact negatively. If you have like a latex allergy, certain things interact negatively. So are there particular products that, say, a woman post-cancer treatment should avoid or use in particular?
Exactly. Are you talking about moisturizers or lubricants?
We especially things that are topical, in terms of that.
Okay. Well, if you use dilators, you want to be sure to use things that don't disrupt latex, as there may be latex in the dilator. And we do have, I do have an address for you.
Okay,
about,
we'll put it all in the syllabus.
dilators. So yes, if first of all, it has to fit you personally. Mm-hmm. It has to be comfortable for you personally. And you need to really very carefully and read the instructions on whatever you are using as a dilator to see if what kind of lubricant or a moisturizer you can use, because they do tell you what can and cannot be used.
Yeah, sometimes it's a great product. Right?
I want to just interject something, because I don't know whether this was with you, Twila, or was with one of my previous co-hosts. The first time I used the word dilator, her jaw just... Was it you? I can't remember. The first co-host I had, who was wonderful, from who's still on my radio, but I used the word dilator. Her jaw just dropped. She's like, she'd never heard of this. I think a lot of people, unless you're in, unless you need it, probably don't know about it. It's not something we talk about over cocktails and spinach dip. And and so, can you describe what dilators are? I mean, it seems obvious, but
okay. So there are many different kinds of dilators. There's one that I particularly like. I think the thing to keep in mind is it's not the length of the dilator that is important. It is the diameter of the dilator.
Okay, well,
so a
hold on.
dilator.
Before we even go there, like, can we, like, let's scale it all the way back, like, and explain sort of to the lay people what is a dilator?
Okay. So a dilator is an instrument that is used to maintain the caliber of the introitus, or the opening of the vagina. They can be made out of many different products. Most of them are a hard plastic. But again, there are different products. And so as a dilator, you start off with the small one. For some women, that would be the size of a pencil.
Yeah.
And then when that can be inserted with no discomfort, you go to the next size dilator. And not everybody has to start with the pencil size. Some start with the thumb size, or even larger. But it is a gradual stretching. It achieves a gradual stretching of the skin of the opening of the vagina. And again, it's just the opening that needs the stretching. The upper part of the vagina is much, much bigger than the opening.
And I assume that when a woman is using this, they're using a lot of lubrication along with it to facilitate the ease of it and comfort.
Absolutely. Yep.
And I don't know if there's a particular brand that you recommend, June. I usually will tell people to go to a website called vaginismus.com. Is that would you recommend that website? But
yeah,
because you can. These are things you can buy online.
Yes,
and you can also just look it up and see that. In my mind, I think if I hadn't heard of a dilator, it would sound pretty dang scary.
Okay.
And when you look at them, you can see how they're of different sizes, and
right.
They don't look quite as intimidating.
Are these products that you would recommend not sort of just going on to the internet and purchasing and using yourself? Is this something you should use under the guidance of a professional?
I would use the guidance of a professional. There's something about the anatomy that many women don't know, and that is when you're standing, the vagina doesn't go straight up, and people put it in and they hit the bladder, and that's really uncomfortable. So it needs to be inserted straight up for about 1 inch or less, and then directed back toward the rectum, because that is the angle of the vagina.
It's like a hockey stick shape. So
yeah, but that's
a hockey
maybe
stick.
All right, well, L. Can we use L?
Yeah.
L shape. Okay, hockey. It's more like a hockey stick than an L, Dr.
Leave
LaValleur.
it to Eric.
L for LaValleur.
that's all right. I'll allow it. I'm
but
not the professional.
It is but that's a great point, June, because people, they don't understand how the anatomy works. And so I can see if you're trying to put that thing straight in.
Yeah, it hurts.
It hurts.
Well, and like I just wanted to make sure to point that out, because in this day and age of the Google diagnosis, everybody thinks that they have a medical professional because they look things up on Google.
Right.
I know plenty of reasonably intelligent humans that would go look this up, go say, "Oh, I can buy that. It's on Amazon. I have Amazon Prime. I'll ship it to the house." And then attempt to use this without
Amazon
any
Prime.
instruction, and then think, "Oh, well, this failed." But we're not gynecologists.
Yeah.
We have no business just sticking things in there without kind of knowing what you're doing.
Support for the GynoCast is provided by OBGYN West. OBGYN West provides the highest quality care from compassionate providers, including women's health issues from general sexual health to pregnancy care, childbirth, menopause, and beyond. Whether it's your teen's first annual exam, a new baby's on the way, or you're facing the special challenges of middle age, OBGYN West provides a wide array of services. Their doctors and PAs are trained in virtually every type of OBGYN service and procedure. OBGYN West provides exceptional care for women.
What do you, speaking of sticking things in there, this is a little off topic, but I just got to ask you this, doctor, just because we got to do it. What do you think about vaginal steaming?
Oh my gosh! Do not goop this conversation.
I don't think about it.
Thank you.
Have you heard of it, Gwyneth Paltrow's vaginal steaming thing?
Poor Gwyneth Paltrow.
Oh, don't feel
Who
bad for
talked her into this? I'm not sure. No, I don't go there.
So you're not a proponent of
No.
Okay.
Thank
All right,
heavens.
good. Thank you.
I appreciate. I think we've now used that as the measure on the show. That is like the judgment marker. Like if
What
you
else has she
respond, if
done?
you respond even slightly favorably, we go,
Okay, so actually, and this is pertinent to our subject, but what else is she? Stones?
The yoni egg.
The yoni eggs. What do you think of the yoni eggs?
Yoni eggs.
Because they're probably postmenopausal women or women who've had cancer who are looking at
there's
that.
a difference between like yoni eggs as a practice or like Benoit balls, those kinds of things, and she's literally advocating for like a $500 jade one that has like mythical mineral
crystal
properties, crystal healing powers for your vagina. That's like outside of the realm of the conversation of like yoni egg as a concept.
I'd kind of like to get back to the topic.
Okay. All right. Where were we?
I always appreciate when the guest helps keep it from getting too derailed. Actually, in terms of, we've talked a little bit about breast cancer. You've mentioned that there are other cancers. In the sort of scope of, there's such a wide spectrum of cancers, do different cancers impact sexual function differently?
Sure. And they impact sexual function differently with every patient.
Mm-hmm.
But an example, for instance, I was giving a talk and this ENT surgeon came up to me and said, "Don't forget ENT cancer." And I'd never included that. Well, it turns out, first of all, that some of the surgery is fairly significant, removing tongue. Radiation takes away the ability to have saliva, and so the mouth gets very dry. Sometimes there's a lot of coughing, etc. And so people have to look at how they're going to continue to be sexually healthy. And it may be that they have to alter what they do that can still be very pleasurable, but that is more comfortable both for the patient and the patient's partner. We've talked a lot about the patients, but what we really haven't talked about is the patient's partner. And it's so important to include the patient's partner in any kind of sexual dysfunction. We have almost no data looking at sexual partners and their response to their partner's cancer. That is, I'm talking about people who have a partner, of course.
Yeah.
There are people who are not in relationships, but I'm talking about people who have partners.
I'm glad you bring that up because it would be it would obviously be traumatic for both. In many ways.
It can be. Yeah, it can be. And another thing that's really important, no matter the kind of cancer, is what was the sexual relationship like before the cancer diagnosis. And if it was great, it can change. And people need to change sometimes what they do and how they respond. There are some women who, and some men too, who with the diagnosis and treatment of cancer lose their libido because of body image, self-image, whatever reason. But they feel they have to be sexually active with their partner for their partner's sake.
Yeah.
And
May I just go at this from a little different angle? I just want to, because I want to address what you're talking about, but it would be interesting to me to hear your approach, which I get the sense is a holistic approach to the family, the couple, and the patient. But what I'm hearing from you is that whether you're talking about breast cancer or vulvar cancer or throat cancer, you've got the physical response to the cancer, the deformation or the cosmetic, the scarring, the cosmetic aspect, and then you have and the hormonal aspect and the medications, all that. But you also have the psychological, emotional, and relationship aspect. Can you tell us how you might approach a patient coming to you who's had breast cancer, has gone through the therapy, and her partner? Can you kind of tell us how you would address in a holistic way that patient?
Okay. So if we've covered all of the medical issues, the hormonal issues, etc., you have to look at not just the sexual relational issues, but the relational issues. and the sociologic culture in which both of these people were raised. What's in the background that brings
Boy, another thing I just
this.
was not even really thinking about.
Yeah.
Yes. And so I find it critical to see the sexual partner in those women or men who have cancer because, okay, let me give you an example. My husband and I like to do massage, and we have our own massage table. I found out that I was giving him a massage like how I liked it.
Right.
Yeah.
And he was giving me a massage like how he liked it, instead of asking what feels
what do you like?
good to you. And so women and men respond that way. It's a normal human way.
You look through your
to
own lens.
be. You do. You look through the lens of the present, the past, etc.
Yeah. No, that makes sense.
And so, with I'm thinking, I guess specifically with breast and I guess vulvar, but there's the aspect of the vulvar or the vaginal dryness. We talked a little bit about dilators and information on that, and I don't think we addressed, at least in this podcast, we talked a little bit more on the other, but topical estrogen may be an option, and there's some other medications to help with dryness.
Okay. So you have to be very careful in breast cancer or endometrial cancer patients who have estrogen
That's uterine
receptor
cancer,
positive status. And all endometrial cancers are estrogen sensitive. And so the reality is we have almost no data looking at very small doses of estrogen in the vagina. So that would be topical in breast cancer patients. We do have studies that show in people who don't have breast cancer, who are postmenopausal, that if you use, for instance, the little tablet the size of a baby aspirin and put that in the vagina, it does raise estrogen levels for a few days, but then it goes back down. The same with the ring or any other topical vaginal estrogen, with the exception of creams. They stay up. And so we don't know what effect that has. If I have a patient who has breast cancer, I would always speak with their oncologist and tell them what the data are in patients who have no breast cancer, and talk to the woman about, does this increase your risk for recurrence? And say, we don't know. We don't think so, but we don't know. And so this needs to be decided eventually by the woman, but in the presence of all the information that we currently have.
But there's also some non-hormonal ways of improving,
sure.
Like you talked about lubrication and that sort of thing. So having adequate caliber of the vagina, if you're engaging in heterosexual penis-vaginal sex, to maintain the caliber and get adequate lubrication. And how, beyond that, you talked about the personal experience of you and your husband. How do you address some of the other coping with the psychological or emotional issues of perhaps the cosmetic, the body sort of image sort of aspects of what they may be going through?
I think you deal with it in the same way that you deal with body images in the absence of cancer. In a similar way, if women have had a mastectomy, they can look at themselves and see how different they are. And then that gets transported to, that must be what everybody else is thinking, particularly my husband. Because we don't ask.
Yeah.
We don't talk about it.
Yep.
Well, I would imagine that's the importance of having the partner there, so you can see the
a
lens
supportive partner, not just a partner.
Yeah.
Just a partner doesn't do. Has to be a supportive partner.
Are there any differences between same-sex and heterosexual relationships and how they deal with the repercussions of cancer and sexuality? I would imagine no, but I'm just curious what your thoughts are.
Not a lot of data, again. probably the most common that we see in gay men is anal and rectal cancer. And for some of those patients, they wind up having the rectum removed and have a colostomy. And so there's a change of what can be done. Mm-hmm. But there are still other options open. Mm-hmm. In the end, we're all human beings. We're all sexual human beings. Some of us are just wired differently.
Yeah. And so, and I know we've talked a little bit about just, sexuality is not one thing, and being a sexual being is not one thing. And there's the whole aspect of, and there's a simplified sort of vision of what we imagine as the sexual mechanics, but the whole idea of intimacy and touching and connectivity between other people and your partner is crucial for our health.
Right. And it's not just sexual intimacy. What we have found is that when sexual intimacy is lost, other intimacies are lost as well.
Yeah.
There are probably a dozen different kinds of intimacy. So you may have a friend that you share a passion with photography. And so, you're intimate about photography, not sexually intimate, but intimate about photography, or any other of the many intimacies that we can have. But in relationships, we see that in the absence of sexual intimacies, other relational intimacies are also lost.
Yeah, so do you ever find yourself kind of, with your patients and their partners, trying to reframe sort of how they look at sexuality? So I'm not sure if I'm asking this right, but, I think people have sometimes such a narrow vision of what sex or sexuality is. Do you ever just find yourself trying to kind of give them a different lens to look at physical intimacy and emotional intimacy and sexuality?
So I don't try to give it to them. I try to help them discover it. That's really an important thing. Mm-hmm. We need to know how can we be helpful to our patients, and that is not necessarily directing them, but getting them to see other ways of being sexually intimate is really important. And it's not everybody has to find a different way, but some people do. Again, discovering that the skin is a very sexual, intimate organ. And for some people, the ears do it. For some people, the feet do it. For some people, the neck. We all have these areas that to us as an individual are very sensitive in a sexual way. That does not mean that all massage is sexual. Okay, it's in a different context.
Right.
Yeah.
Okay.
Do you ever find yourself, just as kind of in response to something else you said, that sometimes when sexual intimacy goes away, other forms of intimacy go away. Do you ever find yourself having to actually kind of reinforce with the couple the importance of trying to maintain a sexual relationship in however you want to define it, as a way of kind of bulwarking their whole relationship? And just like saying, it's important as a couple that you don't let this go away when you're just obviously distracted by other things, probably.
So Eric has this wonderful way of answering the questions that he asks. And my answer would be yes.
I'm sorry, Doctor. You are brilliant. Your answer is absolutely penetrating and brilliant. Well, so when in your practice as a sexual health expert, when in the process of a woman's or man's treatment in cancer, would you want them to see you? And if they, I suppose I know what you're going to say. It's different from everybody, but what do you say? Because I'm curious to know where you would want, ideally in a perfect world, when you would want them to come in and address their concerns and issues with you.
Okay. So again, not all people diagnosed with cancer have sexual function issues, but for those who do, it would be in the recovery phase.
Mm-hmm.
So when they're really done with treatment and are on the road to being healthy again. And if a sexual dysfunction has shown up, that is bothersome to the patient or the partner. It needs to be bothersome. It needs to have affected the relationship.
Okay. So I want to thank you again, Dr. LaValleur, very much for talking about this subject. This has been fun, and we're talking about serious stuff, so I kind of hesitate to use the word fun, but it is. I feel like it's fun to talk about things of importance,
Right.
And I feel like this is something that is so overlooked in so many ways and has such grave impact on people's quality of lives.
Yes,
And so I
agree.
just really have enjoyed being able to spend this time with you to talk about this important subject. We will have contact information where, Twila Dang?
Or on our website. So if you go to matriarchdm.com, that is the Matriarch Digital Media website, there's a show page for the GynoCast. We will have the syllabus of today's episode there, contact information for Dr. LaValleur, as well as all the resources that she talked about today during the episode. You can also get a hold of us on Facebook. So if you go to Facebook and look up the GynoCast, you should already be a member, but if you're not...
Shame? Nope, I'm not going to shame.
Yes, no shaming. No shaming our friends. You can
It's
go...
an exclusive club, more exclusive than Costco by a long shot. Because if you're a total
by
knucklehead, you will
far.
not get in.
By far.
We screen. I hate to tell you
Okay.
this, but we will screen
Well,
anybody.
no, that actually I agree with you. That I'm very serious about. If you go if you go to the page and request to be a member, we do vet you. We don't just let anybody in. We have very serious, specific, sometimes challenging, sometimes sensitive conversations, and we want to make sure the people in that space treat those conversations respectfully. We have been very
sacred
fortunate.
space.
Yes, it is absolutely, and we are so fortunate that the group of people, 2,000 or so and counting, are wonderful and supportive of one another and have respectful, even sometimes disagreeable conversations, but always with respect and support. And we want to make sure that continues. So we will vet you,
right.
and if we allow you in, you can come in, you can propose topics, you can share information, you can ask questions and seek out support. All of those things can happen on that page.
That's right. And we still believe, Twila, I'm going to speak for both of us.
Okay.
I'm just going to do it.
I do.
That you can still have a civil discussion about differences.
Absolutely.
Respectful and civil discussions about things that people feel strongly about.
And I agree with you wholeheartedly, and I've said this before, I'll say it again. Eric built that page long before I came along, and I have marveled at the ability that he has to measure and support and disagree and mediate when things get, heated and people, have a very specific point of view, but it is always done with such an air of support and respect, and ultimately we can agree to disagree and still continue to share the space. And that is something that we are missing and in our wider conversations today, and I love that we have a forum that we have used and that we have cultivated that provides that. So
That's right.
we want to see that continue. You can also email the show. If you email hello@matriarchdm.com, you can let us know what you think. You
Is that
can
one
ask
L
more.
or two?
The
Is that
same
one
way
L?
you always spell hello. No,
I spell it with one L.
I'm now going to be like the
I grew up in a small
I'm
town.
going to be the fun kids on the internet, put 3 L's and like an obelisk in there now. No, it's just the standard HELLO at matriarchdm.com. And we would love to hear from you.
And remember, the vagina is shaped like an L for LaValleur.
And on that
Thank you
note,
for listening.
Thank you. We'll talk
Thank
to
you for having me.